So, welcome back, everyone, for another episode of Sickish. This is the platform where we have candid conversations on navigating chronic illness. I am your host, Rita Pierre, and today we are with the amazing Dr. India Barkley, who is going to talk to us about acupuncture and its benefits for individuals who are living with chronic illness. So, Dr. India, please welcome to the Sickish platform.
Thank you so much. I appreciate being on the Sickish platform. I'm excited to be here, excited to answer questions, getting into some dialogue about my love for this medicine.
Great. So, Dr. India, please introduce yourself. Tell us a little bit more about who you are, what you do, where you're from.
Sure. So, well, I am professionally a tenured doctor of acupuncture. I am an educator of East Asian medicine as well at the graduate level. I'm also a Reiki master teacher and practitioner, so I also practice Reiki. I'm the founder of my company, which is called Heal with Yin, which is an energy medicine wellness center, but it's also a provider of energy medicine studies, acupuncture, and Reiki in particular. Let me see. Oh, well, I'm also running the certification program through the Heal with Yin Center, where I teach Reiki levels 1 through 3. And this is like an ongoing intensive training. It's a healing tool that's designed to empower future healers, wellness practitioners, just to be effective in their chosen career path while expanding their potential to facilitate healing.
Okay, great. So, you're doing a lot.
I am.
A lot of positive things.
And I'm a mother too. I'm a mother of a delicious 6-year-old too.
Aw, I love that. A woman's work is never done.
Exactly.
So, Dr. India, I always like to kind of break things down to the basics.
Yes.
We a lot of people have heard about acupuncture. They've heard the term, but are not really sure like what it actually is. So, could you take us, I guess, back to the basics a little bit about what exactly is acupuncture?
I always feel like I'm a good person to ask this because I've taught fundamentals to new incoming acupuncture students. So the way I would always introduce acupuncture, first and foremost, medically, it's a safe, non-pharmacological, non-surgical treatment, right? Which has really evolved into a complete holistic medical system. Like I have patients that treat me like their primary care. And it offers treatments that are very personalized to a patient's unique constitution, their signs, their symptoms, regardless of medical diagnosis. So we work differently. We work in a different paradigm. It doesn't matter what your diagnosis is. I'm more interested in your symptom expression with that diagnosis. And so technically I use, like in terms of the actual mechanics, I use little tiny needles. They're very fine. They're prepackaged, they're sterile, they're disposable, and they're placed into various acupuncture points on the skin. And what I'm doing is I'm activating your energy and balancing your energy to promote natural healing. So I'm really just using your body.
Interesting.
Okay.
Okay.
Yes. And there's an element of endorphins that also gets activated when you have these needles in. So when everyone says, "Oh my God, I feel so good," that's why.
Okay. I've had acupuncture several times before, so I can totally agree with that feeling of like I feel good.
I feel good. Yeah, I don't know what this is, but I feel really good.
Right. Okay. So a lot of the people who are tuning in are individuals who are either interested in this topic of chronic illness or are actually living with chronic illness. And so a lot of times we're always searching, right, for, what can we do to alleviate this pain? What can we do to reduce inflammation and all these other things? And so with acupuncture, I guess, why would you say it's beneficial for an individual who has chronic illness?
So probably one of the main reasons is with chronic with chronic disorders, you're probably managing it with medication. And chronic disease or chronic pain in particular seems to respond extremely well to acupuncture as a drug-free option. So that's probably one of the reasons why most people elect to go to acupuncture or try acupuncture, because it's like, all right, I have to take this medication, but I don't want this to be like a long-term thing, right? To manage my care. So usually I find I get a lot of patients that come into the door because they want to find other alternatives to manage their pain, non-pharmacologically speaking. So yeah, so that's usually the introduction. But then there's tons of very high quality studies. There's empirical data. There's word of mouth that says, the acupuncture is doing something for me. It's keeping me from a very high pain threshold, or it's turning down the volume of my disease. And so it becomes now the patient has the disease, but they have a higher quality of life.
Okay. I like that you mentioned the empirical data because, we live in a society where everything is about where's the data, where's the research.
Absolutely. 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 Indeed. Indeed. So yeah, so there's data. There's data. There is sound data that makes acupuncture a viable evidence-based medicine. Even though for me particularly, I feel that the best evidence is how you feel.
Right.
Like that's the ultimate end goal for me, is how do my patients feel?
Okay. And so I want to talk a little bit about how acupuncture can complement the conventional medical treatments, right, and therapies, because somebody can say, okay, I do want to try, acupuncture, but I've been on these medications for so long. I've been doing these other therapies. I don't want to disturb or disrupt what's happening. So, how would acupuncture fit into this care plan that an individual might have?
Yes. So acupuncture works on the basis of a holistic approach, right? To manage whatever's going on. So we never want you to stop whatever your attending physician is telling you to take or do. But we're going to come in again, and this is a trained acupuncturist, obviously,
Mm.
and we're going to look at the big picture of your diagnosis. So maybe the physician, the specialist, is tending to like the core issue. You still aren't sleeping,
Right.
or you still are feeling this kind of achy pain, or maybe there's an offshoot of pain that's happening elsewhere unrelated.
Mhm.
So acupuncture can come in to support other areas of the body. And again, this is the way the symptoms are uniquely being expressed, because we come from a paradigm where we believe that three people can have, let's say, hypertension, but those three people will express hypertension differently.
Mhm.
And so while there's one protocol for hypertension, there may be other symptoms that it's just like, well, you're just gonna have to deal with it. And we feel like, well, you don't have to just be in pain, or you don't have to suffer. There's other modalities that can help to buffer your experience as you're managing this chronic condition. So the exact pattern and degree of disharmony, it varies from person to person, regardless of diagnosis. And so acupuncture works through a completely different paradigm, helping to alleviate that pain, manage the symptoms of chronic illness.
Okay. Okay. Now, are there specific, I guess, chronic illness conditions that you could think of at least that would, be
Oh my God. Yeah.
beneficial, that would benefit or that acupuncture, I guess, would really, help alleviate? Because, sometimes we'll go to these different practitioners, or we'll go to the doctors or whatever, and we'll say, listen, this is what I have. Like, do you have
Hmm.
experience in this? Like, is
Right.
is this possible that this treatment can potentially like have any effect? So are there certain conditions that you could think of that you're like, yes, definitely have had, whether it's the empirical data, whether it's the word of mouth, that individuals who had X were like, this is the treatment?
Yes. So we are hands down even competitive with conventional medicine in terms of low back pain,
Mm.
hands down. So that's even in the literature. You can find sound research that says acupuncture is a preferential treatment to manage chronic low back pain to the extent that it's actually covered. That's the one thing that's covered by Medicare.
Interesting.
So yeah. So chronic low back pain, we're wave the flags. Acupuncture is what you need to do. But we do help and mitigate other chronic illnesses such as neurological disease, autoimmune. Autoimmune is basically dealing with a lot of inflammatory markers. So acupuncture is amazing with reducing inflammation systemically, gastric disease, reproductive disease. And all of these have an underlying common denominator of inflammation.
Right.
So that's where acupuncture is really good at helping the body deal with inflammation. Lung disorders, mental health. That's another big one that acupuncture
Yeah.
helps improve. Again, because of we see the mind body connection.
Right. And I like that you brought up that piece about the mental health, because we've had some practitioners on the show that talked about the connection
Oh,
between
nice.
mental health and chronic illness.
Yeah.
And a lot of us who are in this world, like we're trying to figure out, one, what is going on with us, right? Because a lot
Right.
of the issues are not necessarily like fully diagnosed issues,
Right.
symptoms.
Right.
And then there's the, well, we still have to move forward with our
Yes.
daily lives, and so a lot
Yes.
of it is a lot of mental anguish. And so I definitely want to highlight that piece of how acupuncture can be beneficial for individuals who are experiencing mental health concerns, because
Yes.
sometimes you know not everybody's ready for therapy, but
Hmm.
there may be other things that can be done to help alleviate whatever's going on.
Yeah, absolutely. And as I mentioned, acupuncture improves the feeling of feeling good.
Hmm.
And we know that also improves mental feeling good. If you physically feel good, then that kind of gives you an effect of mentally feeling good as well.
Right. Okay. So I want to get a little more technical when
Yes.
it comes to how acupuncture is used to like alleviate pain and manage symptoms, right? So I know
Hmm.
there's the needles
Yes.
that come out. So those of you who are afraid of needles, I can tell you, as somebody who also who does not like needles, these needles are not, you do not have to be afraid of them. They don't hurt.
No. Hey, thank you.
They don't hurt. They're not scary, so because I know that's a big thing. People are like, needles, no. But how, because if somebody who's never really experienced acupuncture is just hearing
Yes.
this for the first time, they're like, well, where do you put these needles? Like,
Yes.
how does that work?
Yes. Yes. So we have our own mapping system of where to put needles. And again, because we work from this holistic paradigm that your whole body is an integrated whole. So there's points on your feet that I can use to treat your head. And
Mm,
there's points on your hands that I could use to treat your digestive system. So we don't necessarily need to be hovering over the local area where the problem is. We can treat what we call distal or far away from the body to access that same problem area. And so because we understand the body as this integrated whole, these acupuncture points are connected to sort of a highway or a throughway
mhm,
of energy systems, or we call them meridians in your body.
mhm.
And so these meridians are interconnected. They flow through your skin, through your tissues, through your fascia, through the circulation, and they actually go as deep as the organs. So there's an aspect to acupuncture that's actually internal medicine as well,
Mm,
because it can reach so deeply while just accessing the surface of the skin. So it is an invasive treatment, right? And so what's happening in terms of the biodynamics is I'm inserting a needle into different parts of the body. Sometimes we do a little twist, right? Whenever the needle's inserted. And I'm activating your immune system, right? Because the immune system is tuned, right? It's literally attuned to respond to invasion.
mhm.
So as I'm inserting the needle, your immune system turns on and is like, "Hey, what's going on?" But at a very micro level. So I'm kind of turning on your immune system. I'm turning on bits and pieces of communication in different areas in the body. And then there is a neuromodulation that happens as I'm interacting with the local fascia that actually has a ripple effect. And there's some science that breaks down how that activates neurotransmitters that start to turn on, chemical communication that brings on the endorphin effect. So there's a medical, very medically based explanation of this, and then there's the Chinese medicine base, which just says that I'm activating your chi.
Okay.
So
Yeah.
I'm turning on, I'm awakening parts of your body that, yeah, under normal circumstances, your body would do, but I'm kind of making it a priority. I'm like, hey, focus over here. Hey, come over here. Turn on here. So wherever the needles are, wherever the gua sha or the cupping is, I'm literally telling the body,
Okay.
focus here, come here, and it's kind of awakening your own body's life force to get working, to get repairing, to whatever it is that we need to do. So there's nothing in the needles. I'm not inserting anything.
Hmm.
I'm working with the body's natural system.
Nice. Okay. So, are there any common misconceptions, I guess, about acupuncture that you have been confronted with? And like if so, like how have you addressed them? Because I could think, with anything that is not, I guess, Western, right? A lot
Right.
of times we're programmed to only really understand about Western medicine.
Correct.
There may be misconceptions that unfortunately when they run rampant in the communities, it prevents people from taking advantage of
Absolutely.
things. So can you talk
Absolutely.
about some of them?
Yeah, I thank you for that. Well, one of the biggest misconceptions, as you've highlighted, is that acupuncture is a placebo type medicine, that it's not a viable medicine, that it's not evidence based. However, I challenge all of your listeners to go to PubMed, which is a free search engine website, and punch in acupuncture. There are over 41,000 periodicals that show up. So, if there is nothing to acupuncture, why is it being studied so heavily?
Right.
Okay, so that in itself is evidence that even though it's not mainstream to the degree of it being integrated, it's interesting enough to be studied,
Hmm.
right? And so for me, that's always like, well, why is it being studied? Because something's happening, right, with acupuncture being used. So that growing body of evidence for me increasingly validates the practice of acupuncture. Acupuncture is not painful, as you said, as someone who has had acupuncture. I think it's more important to find your practitioner, to find your person
Hmm.
who is first and foremost someone who you feel that you can feel safe and trustworthy with, and that hears you and listens to your needs. And so if that trust is built, more than likely, acupuncture is not going to be a painful situation, because the technique and the training of that therapist should be at a high standard, and you also feel safe around them. So your nervous system isn't on guard with like white coat syndrome. You feel safe around them, and so the nervous system isn't activated. So I would say a huge misconception that it's not painful. I'm not saying that you won't feel anything, because it actually is therapeutic to feel something, but it is not painful in the traditional sense where we've, I guess, assumed all needles are painful in the way like vaccines are. These are completely different needles. They're so tiny, they're hair thin, and it typically doesn't hurt. It's not painful. So that's definitely another misconception.
Okay.
Um, what's another one? That all you need is one or two sessions, kind of like the way medicine is, or
Mhm.
like a regular drug would be. You would just take an aspirin and that's it. So again, acupuncture is something that has an accumulative effect, and so you have to keep going, so that, again, because we're working holistically and naturally, it's almost like a reprogramming of
Right.
the body. And so that takes time, and I think that's again a retraining of our minds to be more um, patient with
Yeah.
our healing.
Yeah. I
and not so like, get this out of here, take this away. And it's just like, well, no, you've had this chronically for 15 years. It's going to take some time.
Yeah. I'm happy that you mentioned that because I think that because there's just such I guess a lack of understanding and knowledge in many of our communities about acupuncture, that many do expect like, okay, well, after the first visit I'm going to be fine.
Exactly. Oh, yeah, I just had one. It's like, oh, no, 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 no. That's not how this works. And so obviously that person walks away saying acupuncture didn't work.
Right.
And it's like, well, no, that's actually not true. It's just not meant to work like a pill.
Right. Right. Now, is there, I mean, I'm if I'm thinking maybe it depends on what exactly the ailment or the issue is, but is there
Yes.
kind of like a standard where, you say, after 5 treatments, you should hopefully maybe feel something, or 7 treatments,
Yes.
or is it just depends on what's going on with you, and then we'll tell you.
Yes. So, professionally, my chronic patients, I always say this is going to be a long term relationship. So, with chronic management, I would usually need to see patients once a week, sometimes twice a week, depending upon how severe the symptoms are. And in terms of improvement, I'm usually looking for modulations in like sleep. If the sleep improves within the first maybe few sessions, we're doing something.
Mhm.
Something's happening. If the pain level, and sometimes if it's pain related, I would sometimes have to quantify it. So if like the pain is like a 9 out of 10, I need to continuously give the patient the feedback of, oh, today your pain is 7.
Mhm.
You still feel it, but it's at a 7 because you're rating it as a 7. And so sometimes that communication also helps to give us some sense of how long we need to continue prescribing acupuncture. Another is basically, sometimes for some, the goal is to reduce medication or to completely have more like a higher quality of life in some
Mhm.
regard. So maybe the goal is, I want to be able to travel, but this chronic pain is preventing me from travel. So I'll work with the patient to at least get them to that place.
Okay.
So yeah, again, it depends on what's being presented, whatever the goals are. But I'm very goal orientated in terms of what do you want to get out of this experience, so that I can know the limitations of acupuncture, because I don't have a needle that can put bones back together, and I don't
Right.
have a needle. I don't have a needle that can stop you from bleeding immediately. So I know my boundaries. I know my jurisdictions. I always say I'm not an acute emergency medicine doctor.
Mhm.
I'm not that doctor you call. Call me when you're ready to be empowered by your health, when you're not afraid to get in the driving seat of what it's going to be required to keep you healthy. Call me.
Okay.
That's the kind of doctor that I am.
Has there ever been situations where somebody was I don't want to say it was on acupuncture for like months upon months, or I mean, I'm just thinking about individuals who might,
Yeah.
do I need to do this forever?
Yeah.
Forever thing.
Yeah. Um, I think, and this is again because we're all very different in our empirical experience clinically. I think what happens is the symptoms get managed to a degree where I actually don't need acupuncture, but I want acupuncture to maintain
I
my health.
see.
I don't need it, but I want it because I feel so good. And the same way we're in front of taking care of our cars. The car's
Mhm.
not working. It's just we want to stay on top of taking care of the car, so we get maintenance. So
Mhm.
I think acupuncture shifts from chronic health management to maintenance. And then it does become this long-term thing. And for me, I think that's the beauty in it, because it can wear so many hats, and it can
Mhm.
grow with the patient. I'm the kind of doctor who I want to give you tools that one day, if I'm not around or you can't schedule with me, you have tools that you can do at home
Mhm.
that can offer relief from whatever chronic ailment that you're dealing with.
Okay, I like that. Because I could see how somebody might say, "Wait, their relationship's over."
Right, right. Exactly. Wait, no, I actually know. I think I have something going on. And it's just like, no, I don't want you to recreate issues, but we can just shift this relationship to just a management type thing.
Yes. Okay. So I know we talked about a lot of benefits. Are there any potential risks or side effects associated with acupuncture? I would say in general or specifically with individuals who are dealing with chronic illness.
I have to say very little. And one of the reasons why I love this medicine, we have very little side effects in
Mhm.
the sense that you can overdose it. You can't overdose acupuncture. Um, However, I will say that if you don't do it enough, you can maybe not feel the potency of it. So,
Mhm.
like, let's say for chronic management, you need to come once a week, but you're only coming once a month. That's not going to do anything. That's
Mhm.
not going to do anything. So, rather than being a potential risk, it's more so you won't feel the efficacy of it.
Okay.
Now there are like technical risks if someone isn't trained, right? Um, like there are certain things that come with being needled, which makes common sense. Like there may be a little bit of blood, a little bit
Mhm.
of blood there because it's close to capillaries. That's all normal. With cupping, there could be some bruising. Again, that's therapeutically normal. So those aren't risks. Those are just things that kind of come with being needled or worked on.
Mhm.
But if someone's not trained, and there are people in our industry that don't need to go through the entire 6 year, 5 year training that can just get a certificate because they're medical doctors. Sometimes that training isn't there. And so we have a medical word called a pneumothorax, which is the needle went too deep and it punctured like lung tissue.
Mm.
Now, the rate at which that happens is so rare because again acupuncturists are trained and we typically don't have to go deep. We don't have to go deep, but if someone is not trained, they don't do acupuncture often, they just do it kind of as a one off, they
Right.
may not be trained in the proper depth, because they just got a certificate. So I don't know if that's publicly known, but a doctor can be trained in acupuncture, but it's not the traditional training, it's a certificate.
See, I don't. Well, maybe I don't know if I knew that, but I know a lot of people do
Yeah,
not know that because they
yeah,
barely know about acupuncture.
right, right. And so a patient would, to their mind, oh, I went to an acupuncturist. Actually, that's a doctor who was certified in acupuncture. That wasn't a
Mm.
trained acupuncturist that went through years of training.
Right. So we need to ask some questions, guys. It
Yes, you
sounds
do.
we
Yes, you
need to ask
do.
some-
Absolutely. Absolutely. Because there is a difference. There's a difference. There's also physical therapists that do something called dry needling. They're not acupuncturists, but they
Mm.
have within the jurisdiction of their license to use needles for dry needling. That's not acupuncture in the breadth of the medicine the way an acupuncturist practice too.
Mhm. Right.
Yes, so there's some fine lines there in terms of what the overall professional experience could be from the patient side. That really depends on, well, who's giving it to you, who's the trained therapist.
Right, right. No, I think that's so important, and I'm really happy you highlighted that because I think, after this episode, people are going to be running to go get acupuncture,
I
and
hope so.
and we want to make sure they're running towards,
trained
somebody.
trained, yes,
Right,
that are
right.
trained acupuncturists. And not to say, again, this is not to speak negatively to doctors or PTs that use acupuncture. It's just we're looking at different lengths of time and training.
Mhm.
That's
Right,
it. That's
right.
it.
Yeah. And I think, I mean, I'm speaking for myself, as somebody who's kind of been through the doctor realm. It's like, you kind of want to just make sure that you go to the person that has all the
All
qualifications,
the qualifications.
just
Yes.
so that, you're there's a peace of mind, I would say.
Yes, exactly.
Yeah.
Exactly. So yes.
Okay. So I know we talk a lot about lifestyle changes when we discuss like, holistic
Mhm.
practices and overall well-being, but I find that people are like, they find lifestyle changes, that phrase, like daunting, right? Like, wait, I can't eat this pizza anymore. I can't have this cup of alcohol. So
True.
so it's a daunting phrase, but I want to ask, are there any lifestyle changes or self-care practices that you feel like individuals, particularly with chronic illness, can incorporate alongside of their acupuncture treatments that could really like amplify their overall, experience and well-being?
Oh my God, so many. I hope your audience is ready because
Yes. We're ready. We're always ready.
so yeah. So when I'm dealing with chronic illness or chronic issues, I am looking at a person who is maintaining a high level of stress, right? Immediately.
Mhm.
And whether that's because the stress came in and it settled into their bodies, and now we have a chronic condition, or the stress of the condition is now a stressor.
Mhm. Mhm.
And so now they have chronic stress. So I'm looking at someone who has a very heightened nervous system. And so I look at that person with an understanding that in terms of lifestyle, we have to chip away at anything that is a heightened stressor that's adding to the plate, that's causing spikes in stress. And I leave that to the patient to decide what those things are, whether it's people, whether it's a certain environment, such as a work environment, a home environment. So I start to kind of bring this understanding that peace of mind is at the root of your body accessing normalcy. Like we have to get to a place of you being more comfortable with states of peace and states of calm.
Mhm.
And so working physically with the body, I use the time that we have together to introduce states of calm. So when they leave my sessions, how they feel is what we want to normalize. we want to we want to normalize this feeling and not the feeling of chronic stress, chronic pain,
Mhm. Yeah.
right?
Yeah.
So that's kind of like how I approach like a chronic patient. Lifestyle changes that are imperative to healing chronic disease is an appropriate amount of rest, specifically between the hours of 11 p.m. and 3. So those are the most restorative times of the evening that your body is doing the most repair. So I don't care what you're doing, I need you down at least horizontally in your bed
Mhm.
between 11 and 3 a.m., preferably in your deepest sleep during that time. And so, whatever we have to do to get you there has to happen to make this whole experience worthwhile.
Mhm.
The acupuncture, the healing, this journey. We need to get you sleeping deeper and during those windows. So, that's also necessary. Hydration, super important, because again, if we're dealing with chronic states of stress, we may be dealing with chronic inflammation. And Chinese medicine sees inflammation as heat. And so you're overheated. You have a lot more heat than the average person, or you have a lot more stress than the average person. So we need to keep your body extremely hydrated. So hydration is super important for my chronic patients in terms of lifestyle changes. And then, there's dietary stuff as well. Again, depending upon the chronic issue, I
Mhm.
usually subscribe more to a diet that's a little bit more alkaline, more plant based, because that's always going to keep the body cooler.
Right.
Again, we're dealing with inflammatory markers, heat. And then in our pyramid, we have a nutritional pyramid in Eastern medicine. The base food actually isn't a food, it's your mind.
Oh, wow.
So yeah, that's it. The bottom, that column, has nothing to do with a food group. It's your mind, and it's what we call like mind-based awareness practices. So
Mhm.
with my chronic patients, I always say we need to bring more awareness practices into your life. So what does that mean? Um, being fully present when you're eating your food, being fully present when you're walking, not multitasking as much, doing one thing at a time, right? So just bringing more awareness into your daily experience actually has a calming effect on the body. And so all of these things are different ways in which we're cooling down the system, bringing more calm into the nervous system, less alert, less heightened stress, less survival mode.
Mhm.
And so that's kind of my approach in terms of managing chronic illness and making those lifestyle adjustments.
I love everything that you just said. As we're talking, I'm like, "Ooh, I gotta do a lot of work." I have so much work to do, but
We all do. We all do.
but I think, the this idea of the heat, I think is so it's powerful to me at least. And I think that as you talk about things that to bring down the heat, I think
Mhm.
people who are tuning in are probably doing the same thing that I'm doing. Like, oh my gosh, let me put this phone
Hot.
away. I'm too hot. I'm multitasking up the wazoo. I'm not drinking enough water. I'm not being mindful because when you're eating, you're probably also watching TV or also scrolling emails. So it's so interesting, like the little things that we do on the daily basis, like how those things can be contributing to our heat index.
Correct. Which is just inflammation in Western medicine.
Yeah.
So when you go to your acupuncturist, we say heat. You go to
Mhm.
your Western doctor, they say inflammation.
Right, right. But it's interesting though that, a lot of us who have like the high inflammation, it's kind of like, well, this is what you have, and then that's it.
It. Good luck. Good luck.
So I really do hope that the listeners are starting to kind of make some connections, and can like start thinking about everything that's being said today, and figuring out what next steps could be for them in their journeys.
Absolutely.
Yeah. So I guess, since we're coming toward the end, I do want to ask, what advice would you give to someone who's considering trying acupuncture, for their chronic illness, or even if they don't have a chronic illness per se, but
Mhm.
just interested in just just overall lifestyle changes and wants to incorporate acupuncture as part of their wellness journey, but they're hesitant to do so. I know we addressed some of the common misconceptions and we talked about potential side effects, but it's a new concept for most people. So what advice would you give to somebody who's interested but hesitant?
I'm going to take a leap of faith here and say that it's important to connect with your person, with your acupuncturist. So I am a Black woman acupuncturist. I am a rarity.
Mhm. Yep.
And so that for me has already been I'm in to a lot of patients. Like
Mhm.
I'm in because I'm interested in this medicine, but you already speak my language. You may know a great deal about why I have certain stresses.
Right.
So, I think for me, as of late, I want to say definitely post pandemic, that's been huge. That, I feel more comfortable because you're a woman of color. I feel like I can identify with you and I'm really listening. It's not just seeing another trained, medical expert. Like I really feel like you care and there's a genuine connection between what are some of the things that are some of the disharmonies in my body. So, but most importantly, there needs to be a trust bond. You have to feel safe and trustworthy with
Mhm.
whatever practitioner you decide, because that can make or break the whole acupuncture experience. And then you tell yourself, oh, acupuncture didn't work. And it's just like, well, maybe you just didn't like the person or there was no connection.
Mhm.
Right. So this medicine, I think it's very important to feel connected, to feel heard, to feel seen by the trained acupuncturist. That's super important. Um, And then, like anything else, you don't know what you don't know. So you have to give it a try
Right.
and see if acupuncture did anything for you, if it was just an experience, or if it was something that actually did add value to how you felt. Um, and this can come in and plug into any train any protocol that you're currently doing. So it doesn't have to change anything. It's not like you have to start acupuncture and stop something. It's
Mhm.
complementary. So it's meant to fit into everything else that you're doing and complement it. So you gotta try. You have to give it a shot, and ask questions. A lot of us do consultations. We'll get on the phone. We'll ask all your crazy questions. No question's a silly question. Most of us are pretty warm and empathetic, very heart centered practitioners. So, give us a call and ask all your fearful questions. If maybe you need to see a needle in person.
Right.
You actually, because usually it's those little things. It's like, oh, I'm scared of needles, and right, but again, you don't know what you don't know. So I would definitely say try, but try to align with the acupuncturist and try to feel connected with them first.
Okay. I love that. I love that. And so, Dr. India, I definitely want you to share your information because
Oh,
people are
sure.
probably like, I definitely need to book a session with her. Like, this is amazing. Is she available now? So, share all of your social media,
Oh, I'd be happy
handles,
to.
websites, etc.
Sure. So I am currently home based out of Poughkeepsie, New York. That's upstate New York, but I have a practice on Fifth Avenue near Union Square on 16th Street on Fifth Avenue. My website where you can find me and all things is drindialac.com. I'm also on Instagram under Dr. India LAC. And I am here and happy to answer questions and to just be of service because I absolutely love this medicine.
Thank you so much. And we can feel it. I can feel that you love this medicine. This is positive. We want our doctors to be happy
Yes,
what they're doing.
exactly. Exactly. I like that you like what you do.
Yes. Oh man, but thank you so much for coming
Yes.
on and
Oh,
being
it's my
so
pleasure.
lighthearted and just being so open and candid about this area that is just it's foreign to so many of us, particularly in our Black community. So
Mhm.
many of us, I was fortunate enough to learn about it because of a job that I had at an Oriental medical
Wow.
school. Before that, I never knew what acupuncture
Yeah.
was. And so, but that's something that just happened. Most people have no idea. And so I think with all of the benefits,
Mhm.
from, Chinese medicine, Oriental medicine, just that whole like realm. I think it's so important for us to, to have more conversations like this. And I love that, that we have you as a Black practitioner because that's
Yes.
the first, like you were saying, like the first, I guess,
Huge.
door to many people who are like, oh, I don't know about this.
It's
So
huge.
yeah,
It's huge. It's huge. So yes, and
I
I'm here for us.
I love it. I love it. And so, just again, just so happy that you were able to just take your time. I know you're very busy to be part of this show to educate us and just to really kind of help guide us. And I think to give us hope too, because so many of us are literally we're at our wits end and we're like we don't know what else to do, and so this might be that last stitch effort for somebody who's literally like on the outs right now. So I really do appreciate you for just being available to this community. So
Yeah, and if it just yields one person walking into an acupuncturist office, I mean that's we've done our job.
definitely, definitely. So we definitely want to have you back on here
Oh,
again.
I'd be happy to come back. This was awesome, Rita. Thank you.
You're welcome. And so, everyone, thank you for tuning into another episode of Sickish, the podcast where we have candid conversations on navigating chronic illness. This is your host, Rita Pierre, and we will talk to you guys next time.